Welcome to IVF Real Talk.
I'm Lucy.
And I'm Yael. Welcome back, guys. Today we're joined by the lovely nurse Jane.
Welcome.
Hi, guys.
Today we're talking about regional care, and Jane, who's a regional care nurse and team leader at Monash IVF, will talk us through it.
But before we do, Jane, would love to hand it over to you to tell the listeners a little bit about yourself and how you ended up in the IVF space.
Absolutely. So I'm a registered nurse and a registered midwife. Before I was with Monash IVF, I was working in MGP practice as a midwife, and I loved it. It was an amazing job. I've always worked in women's health, and then I just really wanted to learn more. I wanted to know how else I could help women and what more I could kind of give to women's health. Then I joined Monash IVF, and boy, was I humbled. I thought I knew so much about women's health, and I remember in my first few months really learning IVF here, I wasn't even sure if I really ever knew what a period was. So since then, I've learned so much, and I've been here for nearly 5 years now, and I love it.
That's such a long time. Have you always wanted to get into nursing?
Always. I've always had this big passion for nursing and mums and women. It's always been a big part of my life. I've grown up as the youngest of 4 sisters. And even my nieces and nephews, I've got like 7 nieces, 1 nephew, 1 boy slipped in there. So I've grown up in a family of girls, and women have always just been such a big inspiration for me. So I'm genuinely so proud to work here and be able to help women and families so much.
Oh, and you nurses are angels. Like, I think nurses across any field you've got to be a special person to be a nurse.
And we were just chatting offline, and Jane was showing us both compassion. I'm a little bit sick today.
Yeah.
Yael's going through it over here too.
Yeah, Mum's just had, literally today, there's something wrong with us. But yeah, Mum's just had her bypass surgery. So it's just all happening. But yeah, and it's a bit fitting having nurse Jane on with us. So
she's super caring behind the scenes. So we love it.
Yeah. Okay. Do you want to get started? Should we jump in?
Yeah, absolutely.
You ready, Jane?
I'm ready.
We've got some questions.
We do.
And we'll get started with question 1.
Do you want to kick us off?
Yeah, let's go. So what does fertility treatment look like for those who live regionally, and how's it different to us city folks?
Look, it does look very similar to how it looks in big metropolitan cities in terms of what a cycle might look like, what IVF might look like in general. Where it does differ is that some of our regional clinics, we have to run them as if they're like satellite clinics. So potentially they're not a home for our scientists. We don't have biological material on site all the time. So we do have to structure or plan our runs, our sessions, and there's a lot of thought and a lot of work that goes into that. So unlike our big metropolitan cities, city clinics where you can just have your period and start your cycle straight away, that's probably where we find the biggest difference, because we have specific days where we would like people to have a period or start their cycle. And that's where we find the biggest difference between the clinics. Some of the care that we offer is definitely mixed between in-clinic and external providers like scans or pathology clinics that will do our bloods or scans for us, because we potentially don't have that on site. But otherwise, the full journey itself is really similar to what it is in our bigger clinics, in our inner city clinics.
I think that's reassuring to know, because I was born in a country town, 3,000 people, very small. We didn't even have a hospital in our town. We had to drive to the next city.
Yeah.
And I think it's good to know that it is very similar, like you said, because I think it's already isolating going through the journey.
Oh, absolutely.
But living regional or in the country, you already feel isolated because you're not near a city. Your neighbour might be kilometres down the road, but it's good to know that the nurses are there, the care teams are there to help support the patients still, and there's not many differences.
Yeah, and I like the third-party option, to give people places to go for scans and building that third party, so it's not always, because we've known a few people that have gone through the journey remotely, and there's a lot of driving and a lot of getting to the clinics, and so if you can eliminate some of the bloods and some of the scans, it reduces, I'm assuming, loads of pressure.
Yeah, especially when there's so many appointments.
Yeah.
So many appointments.
Yeah, never ending. The next question, I can imagine being a nurse regionally could be harder to build relationships as you're not seeing your patients face to face a lot of the time. How do you support them through the fertility journey?
I guess given everything in the last few years that has happened in the world, especially in healthcare and how we've really transitioned to using things like Zoom or Teams or telehealth, the regional nurses have really taken that on board and we're running with it. The option to have Zoom and to have face-to-face connection with our patients that are regional rather than just being like only offering in-clinic appointments, that's the way that we connect with our patients. And that's really important. That's a really useful tool for us. So that's the biggest thing that we found has really worked for us and our patients in the last few years.
We get to thank COVID for that.
I know. I think before COVID, nobody thought we could do anything remotely.
No. Yeah.
And now everything is remotely. So, you know.
Our work, my actual daytime job, exactly the same. Like we were like never could work from home. And within, a week we were all at home. And so it's amazing how the world changed. But I would hands down take a telehealth appointment over going in today, definitely. And to be able to jump on a Zoom with the nurses would be so comforting. And I think it's also more efficient.
In your own time, in your own space. And it's really beneficial. And to be able to have that connection in the comfort of your own home or without having to take time off work because you're on your lunch break and you can Zoom from the car or in the lunchroom, it's so much better and way more convenient.
Yeah, especially
I never really thought about the work piece.
Yeah, because so many of us are hiding it from work. So,
but you could duck into a focus room or one of the meeting rooms or whatever it is and just quickly jump on a Zoom on your phone. You're so right. Whereas we would be ducking off and like, I'm literally late because
driving to the city
for whatever reason and hiding it. But that does add options really and flexibility.
Which is cool.
Yeah. So the next question we've got is, what are the biggest challenges for regional patients and how does Monash IVF help ensure they feel well cared for no matter where they live?
The most common challenge that we find, like the day-to-day challenges that we see the most often is things like our medications. IVF is very specific in terms of the medications that we need, that we use. They're not everyday medications that every pharmacy will have access to all the time. Some of them have a really short shelf life, so they expire really quickly. What we do and what we really make an effort to do and to make sure that we're in the communities and out speaking about is having connections with our external providers, including our pharmacies. So it's really important for us to make sure that they are up to date with the medications that our specialists are using to make sure that they have enough for our patients to access whenever they need it. Obviously, there's some super crucial time important medications that patients need during IVF cycles, and we need them to have it available to us all the time, regardless of whether the patient needs it right now or whether they need it next week. So for Monash, we definitely work really hard in trying to build that relationship with the pharmacy so we know we can trust them that they're going to have this medication and come through when it's needed.
Yeah, I never thought about that because in the US, I don't know if you've ever seen, but a lot of the US patients, they get their medication always delivered. They never pick it up. Have you noticed that?
I didn't know that.
Yes. I think I need to ask. We need to do a poll.
Yes, we need to.
But I never wanted to get my medication delivered.
No, imagine
because I'm like temperature control. I want to go to the pharmacy and pick it up
into my freezer bag and take it home.
We definitely have pharmacies that we have these connections with that patients can go in on site and pick up their medications. Otherwise, we definitely have a handful of courier services that know our medications and work with our medications and understand what needs to be temperature controlled and if it's likely going to get there where it should in time and be picked up and be used. So it's really about having these deep connections with these pharmacies to be able to give our patients everything that they need when they need it.
And that's so true because there would be people that are like, there's like regional, and then there's like even like that the pharmacy's still too far. So that makes a lot of sense that you might need to courier, and if at least it's going in a freezer bag and the temperature's controlled, then what's the difference? And that door service was pretty cool.
I didn't realize a lot of the some of the medications have a low shelf life.
Yeah, that I didn't know either.
Yes, they do, which is very specific for some of our clinicians using this type of medication. Potentially it only might last for 3 months. So if you think we're trying to schedule in sessions that are potentially like every 6 weeks at a site, but the medication only lasts for 3 months, is it going to be in date by the time the patient's finished using it? Can we really trust that that medication is going to be effective? So it's really important.
Wow.
Yeah, a lot of layers to it. We know a lot of people travel for fertility treatments, IVF, even interstate or overseas. What message would you share with someone wondering how regional or local care compares to city-based care?
Look, I don't think you always have to travel for IVF fertility treatment. I think it's really important to know what options you have close to you and close to your community. I think that's the first place to start. Our nurse inquiry team, our 1-800 number is the best point of call for that, because they can help you find a specialist that's close to you. I don't think travel is essential for IVF. I definitely understand when patients have a specific clinician in mind, or they've been with a clinician for a really long time and maybe have relocated regional and they're traveling for that purpose. Otherwise, the care that's being given regionally and in our big metro clinics is going to be exactly the same. It is on par, and you are getting everything that a big major city clinic would give.
Yeah, that's so good to know, because I do know of some patients who literally would travel all the way into Melbourne.
Yes.
Which would be like a 3-hour not even round trip, one way.
And but Jo would stay like
Jody?
the night. Yeah.
Yeah.
She'd stay.
But that's a big cost
for the
too.
night.
That's
Both
a big
Joes.
cost.
So also Jo and Addie used to travel too.
Oh, yes.
Yeah, and they'd stay for the night. Like they'd go and have a hotel and they'd stay for egg collection and sometimes, And so, it ends up
It's
adding up.
really expensive. And if you think about the leave that maybe you're requesting from work and you're telling them that you're going through IVF and you're taking your sick leave or your annual leave to do something like fertility treatment when you're actually not sick, you're just trying to care. It's not necessarily needed depending on the clinician that you want to work with.
Yeah, that's true. Jane, do you see that more regional patients are more likely to, due to the distance, maybe delay treatment? And what impact does that have?
Definitely. So we can definitely see a lot of regional patients delay treatment. And I think it's just that initial kind of finding out where the clinics are, what can I do, getting a referral, then that wait list to see that referral because it's in a regional town. Maybe it's already been a year just before they even get to the Monash IVF clinic that they've been trying to get to their GP or delaying the process and they're really busy with work. So it definitely is a thing that we see a lot. I don't think it's something that's depending on the time frame, of course, that they delay their treatment. In terms of like the sessions that we run, we obviously are scheduling them at certain times of the year. If they're delayed too much, it could really impact their outcome, unfortunately.
Jane, I really wanted to touch on the monitoring appointments because we know during IVF there's a lot. But what does it look like for regional patients, and what appointments need to be face-to-face or in person?
The really cool thing with our regional clinics is that we actually have really good connections with our external providers. So our radiology clinics, we can get your scan there because we know them and they know that if we're calling asking for an IVF scan, it's urgent. We know the right pathology clinics to go to make sure that your bloods are going to get collected by the courier and sent to the lab at the right time and go to the right place. So we have these deep connections in these communities to make sure that these tests are run in our urgency, because we do deem IVF really urgent and we do need those results really quickly. So those are normally done off-site. When we do need to see patients is for their egg collections, for their transfers, And that's really all. We're always available when we're in session. Our nurses are always available on site for patients to come in and have a chat to, and we're there physically to meet in person. But otherwise, our egg collection and transfers is definitely our go-to days for patients being on site at the clinic.
Wow, that's cool. And you can plan for that a lot better than all the monitoring in between.
Yeah, you have at least 36 hours notice, which is good. Yes. And transfer, you kind of know when transfer is going to happen. Yeah. But I think that's really cool that you can do all of your scans and blood tests at a local pathology or maybe a medical centre.
Yeah.
Right. Actually, I remember doing my first blood test at a pathology medical centre. Yeah. And that was handy because I just walked up to my local doctors.
Yeah, and I had the difference. My first clinic, I had to do everything there, and my second clinic, I definitely was able to go to, like you said, a specific lab, but any of them, and I could do my bloods there. And that really took a lot of the pressure off and made it more flexible. So I think, but even scans we had to do obviously in clinic, but being able to go somewhere to get your scans done would be definitely beneficial if you're regional too.
I have a question. You know how we get a blood test and it says urgent and you have to do it in the morning, right? So when I would go to the clinic to do my urgent blood tests versus say someone regionally going to a doctor's office or somewhere else to do it, is it just the same process that they have? The collectors will, and where does it go? Because I actually want to know. Do you know where it goes?
And is this 10 o'clock cutoff a thing?
Yeah, is that crucial? If we get there 10:30, is it we're not going to get it that day?
That collection's been done, so you'll go in the next.
That's how it works, unfortunately. So what it is, and we stress this, so I'm so glad you mentioned it because you've obviously heard it, and we do stress this. So having an urgent blood test or your IVF, especially your in-cycle blood test or your pregnancy test, you want to know what that result is as soon as possible. If you're a regional patient, potentially you're going to a pathology clinic, they're taking that blood's going to sit there for maybe 2 hours, and then a courier is going to come and pick that blood up, potentially put it on a plane, fly it to your big metro clinics, send it to the lab there, and then it will start processing. So when we deem it urgent, we're deeming it urgent because we want that process to happen really quickly. And when we say try and go before 10 or 10:30, because we want that blood test result today.
So you're telling me the blood test sample is going on a plane to the major city? What?
That's wild.
It could potentially be not even in the same city as you.
Wow, that is crazy.
Yeah, and sometimes there's delays, so you want to make sure you're first. I'd be first cab off the rank. When are they open? 8 o'clock. I'd go straight away, or 7. But
remember that time? So my first IVF round, I went to my medical centre to do my first blood test. The first day test. I just got my period, and I got to the clinic super early. I think I opened at 9. And anyways, heaps of people started coming and lining up, and I just let everybody go ahead of me. I didn't realize everybody was there for a blood test. I didn't realize that, I should have stayed first in line, I was first in line.
You didn't get one of those number things?
I had to wait literally 1 hour.
Yes.
Yeah, I got the number. I was the last number because I was being nice. I was everybody go in front of me. I don't know. Why did I do that?
I would have been at that door busting straight in pension day at the bank. It's definitely the pressure to get them, and it makes sense. So I think the flexibility of being able to go, any of your partnered labs to be able to do your tests is so good for regional care.
And it's about being able to fit this into your normal everyday, your work life, you're dropping off the kids at school. This should be just slotted into your normal everyday life.
I feel it's more flexible than being in the city so far.
I reckon so far. Maybe we should move.
I know.
But yeah, I agree. Jane, what advice would you offer someone living outside of a major city who's beginning to explore fertility or IVF?
Definitely connect with your nurses. So if you are just touching base with a nurse inquiry team, trying to suss out what's local to you and what your options are, that's a great place to start. Once you're in your clinic and you've chosen your site, your nurse should be your go-to for everything. All of your IVF questions, if something feels weird or something feels different, your nurse should know everything about you that you are willing to give over, because that will help them really understand how this cycle is going to go for you in terms of the support that you have at home, what your work-life balance is. Are you better for emails or phone calls? So your nursing team is literally your go-to person. What is also so important is making sure that you have good connections outside of IVF. So outside of your nurse, to have support, to have family, to have your partner, to have this support system is so crucial. And that really goes for anyone, anywhere, right? Like anywhere, anyone accessing IVF, but specifically in regional areas where it is really remote already.
Yeah. I was going to say that because I feel like it's extra isolating.
Yeah.
Like I remember growing up in the country and it just is, it's quiet, especially when I'd stay on the farm, like my grandparents' farm, and you're not seeing, like your neighbours are kilometres away.
Yeah.
You might not hear any car past you for the whole day past the house. So
that would be really
just
isolating.
naturally it's
But
isolating.
I think, like, I'm going back to when I started, and maybe you can also relate to this or agree with this rather than relate because we don't live remote. But I think when I first started and we were in that headspace of, you know, we're not talking to people, we're not telling anyone, adding being remote to that would make it really hard to think, where do I go? Where do I start? And, knowing that there's like a team of nurses that can direct you and also make regional options, regional treatment, not so like I would feel daunted to think about how I would, you know, do I have to go to the major city, add that on top of already IVF? So, I think that's something that would be my thought.
It is a lot, especially for our regional patients, because potentially, you know, your neighbours may be not doing this and their neighbours not doing this. So you are losing out on that support system that's really local to you. That's why I can't stress enough that if you pick up the phone or if you want to Zoom or if you want to Teams your nurse, go for it.
Yeah, because I think also living remotely or in the country, it's probably even more taboo to be spoken about.
Yeah.
Like in the big smoke in the city, people might talk about IVF a bit more than in the country.
Yeah.
So, Jane, what advice would you give to help regional patients feel prepared, supported and confident when starting IVF for the first time?
Ask questions. Ask every question you can think of, even if it's the question that you wouldn't dare ask anyone else. You can ask your nursing team because we've probably heard it or we probably have the answer to it or it's probably a really normal question. Definitely communication is the best tool that you'll have in your IVF cycle for sure.
Do you guys have a after hours number for regional patients, city patients, or like does that differ at all? Is it one?
Actually, all of our sites will actually have their own mobile phone number that's after hours, and we are available 7 days a week. So if you have got that burning question and it's 9 p.m. at night and something really scary is happening or you're overthinking it and you just need to know, call. Call.
I think that's good though because sometimes you just want to know there's a number you can call because I think when you're on the hormones and you're going through the cycle, you're spiraling and you're feeling these things you've never felt before. But especially when like someone like you is getting OHSS or something like that. I mean, you nurses are always so on top of these things. You guys are great.
Yeah.
But sometimes we do have a burning question or we're just not sure
or
about
you're just
something.
trying to mix your first menopause or like, and you're trying to like not have a meltdown and the clock's ticking and you put all these pressures on. Like, it's nice to know that, hang on a minute, if the shit hits the fan, I can call and speak to someone like Jane and get some answers. And I called many times.
You should, because we get it. We understand completely.
Well, can you tell us, do you ever go on the after hours line? Are you ever the nurse that takes that call? Or do you have like a dedicated person that does that?
No, we all do. We all take turns.
Okay, can you tell us a story? I'd love to know a crazy story if you can share.
You know, taking your trigger injection is such an important, timely, time-sensitive medication that we are so strict about, and we probably drill it into you 1,000 times that day saying you're going to take it at this time tonight. And then I had a patient once who called at the time of taking her trigger, and she didn't actually have her trigger at home. It wasn't in her medication. It wasn't in her fridge. She couldn't find it anywhere. So me and her together were just scrambling, trying to bring every pharmacy that we could that was open, their after hours line, to get her this medication. She had it. She was about 20 minutes late, and the specialist confirmed that was okay. And, we told everyone that we needed to change her egg collection time. But that's exactly what this after hours phone number is for. Moments like these where you're like, oh my goodness.
Wait, where was it? I want to know. Was it just like hidden in the fridge or?
It was in the back of her refrigerator, in the very back of her refrigerator.
Oh my goodness.
Did you jump on like FaceTime and you're like, let's check the box together. Let's check.
Put the camera in the fridge. but I feel like the stress of the trigger shot will make you do that.
That's honestly a part of this.
Yeah.
And this is the reason why we have this after hours contact number for these moments where you're like, okay, just stop for a second. Let's have a look around. Let's think about what we can do, and we'll do it together.
Oh my God. That would have been the worst. Like it's trigger time and you can't find your trigger shot.
Yeah.
I would have died.
I would have died.
And 20 minutes late, I feel like, okay, that's okay. Just
we
push it
now
back 20
know
minutes.
20 minutes late's okay, but
don't say that. Don't say that. Patience, do it on time.
Do it on time. Do as you're told. But, like in hindsight, going back, 20 minutes late, I think we would have just stuck with that. And then depending on the outcome, it could have just been this, oh my God, it's all my fault. And you put so much guilt and blame. So
I would have been crying, like nonstop crying.
Poor Jane would have heard me hysterical on the phone crying. So this is our last question. And for the regional community, how do they access things like counselling, emotional support, fertility education, and what positive developments have you seen in this space?
Again, I'm going to go back to like our Zoom or remote type of connections, because Zoom, telehealth, and like just a Teams meeting, a FaceTime, those types of things are the exact same way that our counsellors can contact our patients. So we totally do referrals just like our inner city clinics. So that doesn't change at all. You still have access to counsellors just like you would if you're in one of our big city clinics. These counsellors are just from your community, so they understand regional care. They understand where you are, where you live, what you're going through, and they can talk to you by Zoom as well. Like it's really easy now, and we've come so far in healthcare that for our regional patients, this is actually the new norm.
Yeah. And I love the fact that they're just going there for the 2 appointments and everything else is literally done for them and around them to help them, because back in the day, I'm guessing they probably would have to go into the city maybe 10, 20 years ago when IVF was first, the early days of art. I can imagine you would have to go to the city.
Yeah, and they'd have to travel, and some people are traveling and staying, then there's accommodation. So, yeah, absolutely. It's definitely come a long way. To be able to just jump on a Zoom, I think is amazing. And even, like you said, to connect with counselling in your own home.
I actually like that better.
Cool. Yeah.
I like that better because then you can literally do it on your lunch break.
Yeah, yeah. But also if you're going through some really hard times, and obviously this journey comes with those hard times, or if you've had a loss or, whatever it is, to be able to do that in your space, in your safe space with a counsellor on Zoom, I would have done that.
Yeah,
for sure.
So important.
So Jane, before we wrap up, if there's anyone that's living regionally and they want to connect, what's the best way for them to do that?
Our nurse inquiry team would definitely be able to help them out.
Okay. Perfect. And we'll put everything in the show notes.
Yes, we'll add it in the show notes.
Jane, thank you so much for joining us today. I think it's been a great episode. I think I've learned a lot because we don't know much about the regional side of things apart from our friends.
Yeah, but we have heard stories. So it's good to actually dive into this today. So thank you.
Thanks, guys. Thanks for having me.
Thank you, everyone. And we'll see you next week. Bye, guys.